To the cloud.
Hi, everybody. This is Dr. Nina Zimmerman, and thank you for joining Nurse Practitioners Changing Practice. I'm Dr. Nina Zimmerman, and Dr. Carol Berger is my co-host and co-founder of this podcast. And we have tonight Dr. Karen Moore. Dr. Karen Moore, welcome to our podcast and our show. It's great for you to be here tonight. How are you?
Fine. Thank you for having me.
You are welcome. You are welcome. Full disclosure, Dr. Karen Moore is not only a colleague of mine, but a dear friend of mine, and I'm very, very excited that she's here to speak with us. Dr. Karen Moore is a dual certified adult and family nurse practitioner. She practices in the Midwest United States of America, actually in St. Louis, Missouri area, and she's a graduate she's an associate professor, in the graduate program at Trudy Busch-Valentine School of Nursing at St. Louis University. Her practice and research interests include global health, infectious disease, healthcare inequities, diversity, occupation and environmental health, and low resource communities in health promotion. Dr. Moore is a fellow of the American Academy of Nursing, and she's a fellow of the American Association of Nurse Practitioners. She's also chair of several committees in both the ANP and American Academy of Nurse, AAN, excuse me. So we are just thrilled you're here, Karen. And we just wanted to have a conversation with you, Karen, about hearing about your nurse practitioner journey in your profession and what you're doing these days.
Well, let's see. The journey, you're pretty familiar with the early part of my journey. I became a nurse practitioner over 20 years ago and started practiced full-time. While I was going through NP school, I also I ran the skills lab at a local school of nursing, and it helped pay my way through school. So that was a good thing. So I didn't come out with a huge amount of debt, which was my goal. I taught there, and then I also practiced full-time during that period of time. And I did practice, probably about 10 years. And then there was a movement. We started hearing more about the DNP. And the DNP is entry to practice. That's when the conversation kind of started on a national level that this was going to be the thing. And the school I was teaching at the time said, we're not going to let anybody stay if you don't have your doctorate.
Right.
So I said, okay. So a few friends of mine and I went back to a school. At the time that we entered, I think there were only maybe 8 or 9 schools that had the DNP. It was pretty early in the incarnation of that. Went back to that, but it was a fit for me because I was very much a clinical nurse. I was a clinical nurse practitioner. I was very embedded in my practice. The translational research made sense to me because the research I was interested in was bedside. So even though I wasn't in a hospital setting, it was really about those things that were going to have an impact right then, figuring out what was wrong in the practice or little things that could be tweaked, ways to make it better, whether it's a process, whether it's, how we move patients through, things as simple as making sure that everybody has a vaccine screening form, from a health promotion standpoint. Getting into things from ACIP and the various vaccine organizations to get those into practice, because in a lot of private practices, and for people who are listening that are just starting in practice, a lot of times you go into a private practice and it may be a smaller group if it's not really with a large hospital setting, and they don't necessarily have the resources or the attachments to big national organizations or repositories of information. When I started 20 years ago, things were not quite as laid out for evidence-based practice as they are now. So frankly, online, the CDC, ACIP has all kinds of resources for NPs and practices. And that was one of my early projects, was saying, hey, these resources are out here for the medical assistants, how they're giving vaccines. I had started training them to give them correctly because when I came in, they weren't really
remember that.
Great. You remember that?
Yes, I remember that.
Yeah. So that was kind of an early part, was trying to bring up the quality of practice for the medical assistants, because in most primary care positions and in most private offices, the medical assistants function largely in a very nursing level role where they're really triaging and assisting and doing all these things, which are not really in their scope. So So if they don't have a good understanding of, for example, if somebody walks in and has a head injury, that you need to get them back right away to be seen, as opposed to fill out your papers and wait, that's kind of a big deal. So kind of helping them to understand that. I pulled in some case scenarios. I looked at various resources online, did some real, what we call now OSCEs, which are observed clinical evaluations. We did them. We didn't call them anything. We just did. Remember that? We created.
I remember. Did it before it was called OSCE. Yeah.
It was an OSCE. Yeah, we were like the cutting edge OSCE people. But we didn't have a word for it. So I guess that's why it never took off from our perspective. But basically it was just intuitive as nurses, right? Because as nurses, you know, when you work on a hospital unit or a hospital floor and you're working with patient care techs or whatever, that there are times when you train them in the ways that nurses think, because your level of education is different than theirs. And so you want to make sure that you're getting good quality outcomes. So I just kind of started doing that, which really is practice change. That's really
right
to do, right?
That's changing practice.
Yes, it really is.
Yeah. And so we do it all the time. We do practice change all the time. So that's why when the DNP opportunity came up and the degree was actually being put out there as a practice doctorate and a translational research, it made sense to me because I was already kind of doing that. I already thought that that was sort of the role of the nurse practitioner to begin with, was to be a nurse leader on the ground in these clinics, doing what we do as nurses and bringing in that additional training of advanced practice. So I started doing that. Like I said, we developed my project for my master's or for my doctorate rather, was about a DOT project. And Nina remembers me talking about
this. Yes, I remember.
You remember that? Yeah.
It was talk about that. Remind everybody what DOT is and what you did. I remember this.
It was DOT is a Department of Transportation, and there are certain credentials. You have to now be a nationally registered certified medical examiner, which I am, and you have to go and you take another test for that to know how.
That was one heck of a test, wasn't it? Yeah. That's all I can say is that was one heck of a test.
And so you have to know basically the rules and regulations about how to certify drivers, what makes them certified for 2 years, 1 year, short period of time, what's disqualifying, all those sorts of things. And the goal of the NRCME and DOT, which is part of the Federal Motor Carrier Safety Administration, FMCSA, so many acronyms.
Yes.
But it's part of that because it's about highway safety. It's about making sure that people aren't going to become suddenly incapacitated on the road. That's the whole goal. So one of the things that was a requirement, now there have been some modifications in this, but when I was doing my DNP, one of the issues and something that we always assess for is stability of diabetes if you have someone who is diabetic.
Yeah.
And I had a particular patient who had come into me and he represented just like a million other patients I had had. This person stuck in my mind though, because it just became the impetus for the project. Came into me and had a very high blood sugar. A1C was over 13. It was 13.
Wow.
Yeah, I remember that. It sticks with me. That was probably 15 years ago. It's still stuck in my head. 13.1. But he had never really had anyone kind of talk to him about his diabetes in a meaningful way. How do you manage that as a trucker? Because truckers have a whole different set of issues, right? Yeah, they're over the road. They don't sleep well sometimes. They have deadlines they have to meet. It's a difficult job. They have to eat at truck stops. They have to eat fast food.
Sedentary, yeah.
Sedentary.
Refrigerator, that's really all they've got. They can't do this meal planning like, you know.
Exactly. So, and back in the older days, I always talk about myself that way, but back then,
I'm right there with you.
It was even more difficult. You know, like now there are a few other restaurants that have maybe healthier choices. Some of the rigs have refrigerators and things like that where drivers do have a little more options. But back when this gentleman had started driving, his truck was really not equipped with that. So he was having to eat when he was over the road at truck stops. And so we started talking about how do you get exercise? You know, if you get out and you walk around your truck, how many times, you know, is a quarter of a mile. So do that at the different truck stops. Maybe you can, you know, if you're given a choice of where to eat instead of, you know, one fast food restaurant, maybe pick one that has grilled foods or has things that could give you a salad or something along that line to really start with the basics of diabetic education. I used to be a diabetic educator too at one point in my life. And so really the rudimentary parts of how you manage diabetes and that big triangle of activity, medications, you know, testing your blood sugar, all those things going into it. And he kind of started to get it. I said, so right now I can't give you a certification. I can't let you come back and see me, you know, in a period of time. We'll look at your fasting blood sugar and see if it's coming down, because his fasting was high as well as his A1C. And at the time we could use either for certification. So oftentimes we would see people, and if their sugars were going down, then we would give them a temporary card and just see them. Yeah. So I gave him a temporary card. At one point he came back to me. I didn't initially, came back to me in a few months, gave him a temporary card, said, I'll see you in 3 months again. And then he started calling me. He would call me from on the road. He would call me and say, hey, can I talk to that Karen? And I'd get on the phone and I'd say, hey, how are you? And he'd go, you know, I'm about to get off at the Jersey Turnpike. My choice is restaurant A or restaurant B. I don't want to say them because I don't want to, you know, do bad for restaurants on a podcast. Which one should I eat at? And I said, well, what do you think you want to eat? How do you feel like you want to eat today? And what are the choices you're going to make when you get in there? So we kind of do this almost lifestyle coaching.
Wow.
Without calling it that. Yeah. And he came back into me. He kept doing this. And this went on for a good 6 months or more. And then finally he came back in to get his card and his A1C was like 8. Yeah, tremendous. It wasn't me. It was just that someone had taken enough time to have conversations with him, to teach him about his disease, to reinforce it. That's what nurses do, right? And that's,
you know, Karen, it wasn't just someone who was talking to him. In fact, we just had a DNP student who did a diabetic coaching call last week or the week before. It's because their provider took that interest. It wasn't just somebody in the office who was coaching them. It was you.
Yeah. Yeah. I believe that too.
Yeah. And I think, you know, you're right. I think it's important because they know that if you're talking to them as a provider, that you're committed to it, you're interested in it, and it's important.
And you care.
Yeah. And you care.
You care about them.
Yeah.
Which, I mean, that's like what was it I can't remember if it was Amanda. I think it's Amanda. But that's what she would say is they would tell her, oh my gosh, you know, you're my provider and took the time to call me. You know, I'm important to you. That means a lot.
Yeah. Yeah, I think so. I think so. And I think that translates. I think that's something that NPs do really well. Yeah. And I think if we're true to ourselves in our training and we're true to our background as nurses, we just need to kind of lean in, you know, lean into what made us great nurses. You don't have to be something else. As an NP, you're not something else. You're an expertly trained advanced practice nurse.
Yes, so absolutely.
Lean in, you know, don't pull back and try to do something else. You just take all those skills, all those things that you used to do and push forward with them. I remember when I would care for patients that had at my practice, if we had patients who had like wounds, my collaborating physician she and I were together for over 20 years and until she retired. She's wonderful, probably one of the smartest people I ever met. And I tell her that too. But we would always talk about if there was someone who came in with a wound issue, she would almost always go to me. Like I would talk to her about certain things. She would talk to me about certain things. But because I had that nursing background, we knew about wound care, right? And so that's, to me, when I think of collaboration, it looked like that collaborative practice I had. It looked like that relationship I had with her because we really respected each other and what we knew and what we brought to the table. And we leaned on each other and relied on each other. There was never a time whenever she wouldn't turn to me and say, hey, Karen, what do you think about da-da-da-da-da? And I'd give my opinion. Sometimes it was right, sometimes it was wrong. But I mean, we would talk through things. We were colleagues. And
that's really important with advanced practice nurses.
Extremely.
To be able to really have that good relationship. Karen, where did you go from doing translational research and thinking about your PhD? Talk about what changed, what happened in your professional career in practice and in nursing education, advanced practice nursing education, that led you to do this change, to do this decision of really pursuing your doctorate in nursing, a PhD in nursing.
funny thing is a lot of people ask me that because they're like, you're not 20 anymore, which is true. I am not. And advanced stats this semester has taught me I do not have the neuroresiliency that I once did, but it's okay. But I will tell you what did it for me was I have always been interested in research on some level, right? I never pictured myself as a researcher. I was an NP. And so that's why the DNP was my thing. And then I started realizing that I could do research. And I did the COVID survey just recently this year on nurse practitioners in the state of Missouri. And then we also expanded to Georgia and just got that published.
Great.
JNP, yeah. And so I started realizing that I am interested in other questions. And the PhD will allow me, it gives me first off some pieces of the research puzzle that the DNP did not, from the perspective of methodologies. I'm comfortable with what I know, but it's opening up other worlds of different ways to think about how to get at more complex issues, more complicated issues. How to bring more issues that are broader to the forefront, and how to get grant funding to support that. Because, as a DNP, there's not a lot of grant funding that's available for bigger research projects. And by that, I mean like, the NIH level grants, the big $1 million grants. Those are really, DNPs are largely shut out of those unless you have a PhD collaborator with you. And so I just decided, I can do that. Like it wasn't a matter of, I think everything in my career, I always tease it, it's like stumbling forward, but it's really just about just continuing to move forward. If you're not moving forward, you really are moving back. I know people say that, and that's a colloquialism, but you can't stay stuck. You always have to think about what's the next thing I want to do? What's the next thing that interests me? I think that if, as a provider, even if you're in practice and you don't plan on doing anything else but being in that practice, stay curious, because that sense of what do I need to learn about diabetes? If I'm seeing 10 diabetic patients, what do I need to learn about hypertension management? How do I get that down a little bit better? Don't be satisfied to give the same captopril you gave today 10 years from now. There are other drugs. There are other things. Go to the CE conferences, learn about what you can learn about. Talk to smarter people than you, get in the room with people who are smarter than you and more impressive than you. I think that sometimes people, especially when you're new, I always tell my students this, you have imposter syndrome. I still have it, like I still want to, yeah, exactly. I'm in a room, like when I go to one of these, the academy conferences, or I'm, chairing one of these committees in the academy, I'm like, oh my kid, do they know who I am? I'm from St. Louis. Like, what is this? Because you really don't, I think in some ways that's how you should be, is don't be so high-minded that you really don't understand that there are people who really know a lot more than you and have lived a different life and have a different perspective, have seen different things. That's how we learn. That's how we stretch, right? And so for me, the thought of doing the PhD was just because I felt like this would give me another avenue to stretch. It would deepen my research. It could have a bigger impact. And I think in your career, you reach a certain point. At first, you're really building your career. And I guess I still am, sort of, but I don't mind telling you, I'm getting up there. I'm mid-50s. Not 60 yet. I'm mid-50s. This little gray streak is just because it's a COVID streak, I call it. But as you get older, you start really thinking about your legacy, and you think about your impact, and you think about what you're leaving the profession with. A friend of mine and I, a colleague from out at University of Wyoming, she and I just wrote an article for, the Voice of the Fellows for JAANP 2 months ago. And it's talking about as we're at this critical juncture of COVID-19 and looking at the DNP as entry to practice, what do we want our profession to look like? What should that look like? Like, where are we going? And I think that all of us who have been in practice for more than 15 minutes really need to think about, where are we going? What are we leaving behind? Are we leaving? Because, I'll be in practice maybe another 10, 15 years, and then hopefully I'll retire at some point, so I can travel somewhere if we ever get out of lockdown.
Yeah.
But I mean, just the thought of of thinking about your legacy and thinking about where you are. I'll give you another example. I had done, there was a colleague of mine that I did some research with on HIV PrEP. She had done some work with Zika, and I had written about Zika. I'd done a national survey of NPs at the American Association of Nurse Practitioners National Conference. So I did this Zika survey. That was interesting, found out what people knew about Zika when Zika was big. And I saw her present on it. And so I just emailed her and said, hey, I saw you're interested in what I'm interested in. Do you want to talk? And so we just started talking. We came up with this HIV PrEP project. The project resulted in, I traveled to Rome and gave a presentation on it. She traveled to Mexico City and gave a presentation. It was presented at a national HIV conference. I mean,
Wow.
yeah, and you don't,
Yeah,
I mean,
you just don't even know. Yeah.
alone. I saw her on TV. I thought she was interesting. I really liked her vibe, and it was kind of like, it just happened. It just happened. And that then led me to, when I was in Rome, I was talking to a couple of colleagues over there, just, talking about stuff. And I messaged JNP, the editors of JNP, and said, and I had done, my colleague in Wyoming, she and I were the guest editors of the infectious disease special edition for JNP.
Wow. Journal of Nurse Practitioners. Wow.
Yeah. And so I messaged him and said, hey, what about doing an HIV special edition? So sure enough, they contacted me and said, yeah, let's do it. You want to be the guest editor? I'm like, okay, sure, that's fine. So that's going to go, our articles are coming in now to be reviewed. But that's another example of just stumbling forward, just, like making connection, being interested, being honest about what it is, right, and pursuing it. It's not that you have to know everything. It's that I think you have to be gutsy enough to say, well, maybe I could do that, or maybe I could contribute in that way, Right. And the PhD to me is just another piece of that, is saying, I could have just said, I'm too old, or I could have just said, I'm too old to go back for that FNP, or I don't need that in my career, or I'm happy where I'm at, or I'm satisfied being here. I can get little grants, I can do my little things, but that's not, to me, just where we're supposed to live, is not, as a human being, is not in the box we put ourselves in. We should be stretching, we should be moving out. And if we as NPs are going to have the greatest impact on people, we have to look at where the door is open and go through it. We have to,
Absolutely.
Where do you see the vision for the NP in the next 10 years?
That's a great question.
Where do you see the NP vision in the next 5 or 10 years going? What would you say to the NP students today as they're beginning that journey that you wish you knew when you were starting this incredible journey you've been on?
I think what I would say to them is, don't be afraid to reach out. Don't be afraid to email that person that you heard speak at a conference that you thought was amazing. Don't be afraid to email them. I can tell you, I get emails from people when I've spoken at different places, and I always email back. I mean, it's not, you never know what those conversations will strike out. If you have an interest, pursue your interest. Even if somebody's saying, well, we don't need NPs in that area right now. Or, if you're really into derm or infectious disease or whatever, even if you're in primary care, go to those conferences. You may meet some really fascinating people who give you another skill set that you didn't know you needed, but it interests you. And I think when you do things you're passionate about, you naturally grow. I think if you're passionate about whatever it is, whether it's, indigent care, whether it's, under-resourced people, whether it's unhoused people, no matter where your niche is, think about where you can make an impact. What is it that you want your legacy to be? If tomorrow I go out and get hit by a bus, which is going to be tough because I'm staying in my house, but if tomorrow, everything is gone, because we're never guaranteed any time on this earth, then I want to know that I've done right by my family, that I've done right by my patients, that my friendships are solid, that I've been ethical, and that I've made a difference. And I think that's really the key. Sometimes when you start out in a career, you may have gone into being an NP because you thought it was like a good income, or you thought it was, you wanted a long white coat, or, whatever reasons that people go into it. They, realize that with with that white coat comes responsibility. But if you take it seriously and you're ethical and you're honest with your patients and you look them in the eyes and you care about them, that's what matters, because those are the relationships and connections that make people's lives better. And in the long run of life, that's why we're here.
That's
right?
why we're here. You said that beautifully, Karen. You really did. And I can tell you from knowing you and working with you and possibly doing some things in the future with you that you said that beautifully. That's really Dr. Karen Moore's mission, is to strive to be better and to do the best you can and make a difference in people's lives. And you are doing that, my friend. You are doing that.
Well, thank you.
I commend you for what all you're doing, and I'll be excited to keep looking and seeing what you're doing in the future. I'll be looking out for your publications in the Journal of Nurse Practitioners, right? The HIV special edition, and
Yeah.
All your presentations on vectors and Zika and all these things that you do.
You know, the infections. Yeah, I like talking about them.
Oh my gosh, yeah. If you want to know about all that, you have to look up Dr. Karen Moore's presentations and papers about that, because she's tremendous. So we just really appreciate you being here today, and I hope the listeners listened and found some things very interesting and helpful about if you're thinking about being an advanced practice nurse, or you are an advanced practice nurse. I think this talk will inspire you and learn some great lessons. Thank you so much for being with us tonight.
And thank you, Dr. Moore.
Yes, thank you, Dr. Moore. And this is Nurse Practitioners Changing Practice. Thank you for being with us tonight.